This is going to be my video validation for topical medicine application for nursing skills 1. Again, what you would want to do first is make sure that you have the correct orders in for the correct patient. You would want to do your first check, the 5 rights. You would want to make sure that you have the correct drug, the correct route, the correct patient, the correct amount and time. So I have an order for eye drops and ear drops. It's the correct order. I have them via the right route. I have it for the right patient, the right amount of each topical medication and at the correct time. So that would have completed my first check. And then I would go to the patient's room and start that after I grab my supplies. So I'm in my patient's room and I would conduct my second check of the 5 rights. I would make sure that my patient has the correct name and MRN on his identification band, which he does. I would make sure that I have the correct medication with me, that I'm going to be administering at the correct route, with the correct amount of the medication and at the correct time, which is all correct. At this point, I will ask the patient to sit in the correct position and explain what we're going to be doing. I'm going to be instilling some eye drops first. So what I'll need you to do is sit upright with your head tilted back looking towards the ceiling. So I would put my gloves on after washing my hands. I would uncap my eye drops. Tilt your head back, and you would also want to place a Kleenex or some kind of cloth of some kind underneath the eye to catch any fluid that may leak out. You're going to want to pull the bottom lid down so you can reveal the conjunctiva sac. You want to make sure not to put any eye drops directly onto the patient's cornea. You'd want to drop it into the bottom part with the conjunctiva sac. And then instruct the patient to hold the lacrimal duct closed for about 30 seconds so the medication doesn't leak into the rest of the body. You would also want to make sure that your eyedropper does not touch the patient's eye at any point, because in that instance, your medication would be no longer good because it would be considered to be unclean. You would have to throw it away. After doing that, I'll take that from you. I would then instill the ear drops. You want to have the patient either sit up or lay down, and in this case I think we can have them sit up. I'm going to instill ear drops. I'm going to tilt your head, and then we're going to sit there for just a couple minutes after I give the ear drops in, just so it's soaking correctly. So you'd want to tilt the patient's ear back, and for adults, you're going to pull the top part of the ear, the pinna, back, and no, your head stays still. Pull the ear back and up just a little bit. We'd want to insert the dropper into the ears and instill the correct amount of drops. And then put a cotton ball or a Kleenex over the patient's ears and instruct them to hold it there for a couple minutes, just so that it doesn't leak out or the patient doesn't run all over the patient. I would have changed gloves in between those also, so I can take that. And that is the end of my demonstration. Oh, I would clean my hands, wash my hands afterwards, and then that's the end of my demonstration.